Mr. Plum.
Thank you, Madam Speaker. I'd like to initially yield 3 minutes to the gentleman from Texas, Mr. Allred, who is the sponsor of the resolution.
The gentleman is recognized.
Thank you, Chairman Pallone, for your leadership, and thank you, Madam Speaker. I am proud to lead the charge on this resolution condemning the administration's attacks on Americans' health care in federal court. With the support of so many of my colleagues, this resolution puts the United States Congress on the record as being on the side of the people. As this administration seeks to tear down our healthcare system, this Congress will not stand by while cynical and partisan attacks on our healthcare system and that of hardworking Americans. Whether it is allowing young people to stay on their parents' insurance until they are 26, or protecting people from lifetime caps, or ensuring folks with pre-existing conditions get the care that they need, this should not be a partisan issue. The fight to protect pre-existing conditions is personal for me. My mother is a breast cancer survivor, and my wife Allie and I just celebrated the birth of our son. Both of those are pre-existing conditions. And concern about health care is by far the number one issue that my constituents talk to me about back home. That brings me to Natalie, a lawyer with young children, Hugo and Mia, who is married to Nathan, a law professor at SMU. Nathan recently attended the State of the Union with me here in Washington. I met Natalie on the same day the House voted to repeal the Affordable Care Act. I learned that she had stage 4 cancer, and that she had come to my event from her chemotherapy treatment. She explained to me that her goal was to fight her cancer for as long as she could, so that her 2 children would know her. Natalie came to my event that day because she was worried about future moms who would lose their care if the Affordable Care Act was repealed. She was concerned about a return to the bad old days with lifetime caps and discrimination against people with pre-existing conditions. Sadly, Natalie passed away last year, but her fight goes on. A fight that I am honored to carry forward on behalf of North Texans here in Washington. My home state of Texas has the highest uninsured rate in the country. 1 in 5 people in Dallas County, where I live, do not have health insurance. We can and must do better. I urge my colleagues on the other side of the aisle, in the House and the Senate, to join us in condemning these attacks on our healthcare system. We must make sure that we don't go back to the bad old days where people can be thrown off their health care just because they got sick. This resolution is a good first step, but we must come together to help our constituents by working together to pass legislation that will stabilize our system and lower costs for everyone. Thank you, and I yield back.
Gentleman from New Jersey reserves. Gentleman